Hey everyone, welcome back to my channel. It's Dr. Alessandro. Please like and subscribe. In this video, I'm going to be reviewing the product called Plax. Now, Plax has been around for a while, and it was labeled as a pre-rinse, which would help to remove plaque and bacteria from the mouth and make brushing effective, or more effective than it actually is when you're brushing. So is this true or is this not true? Does Plax do what it is intended to do? That is, be an effective pre-rinse. Now, this has been studied in the past by a number of different people. So including one study by Chung et al. In the Journal of Clinical Periodontology. And what has been found is the following, that actually Plax does basically nothing. So there is no statistically significant difference when you use Plax as a pre-rinse before you brush your teeth. So while Plax is advertised as a great product to pre-rinse with, and it has, you rinse, enjoy the soft mint flavor for 30 seconds, and you brush thoroughly afterwards, you use a tablespoon of it. Unfortunately, it does not do as advertised according to a number of studies in the 1990s. Now, has that changed? I haven't seen any literature. So maybe the makers of Plax can go ahead and let us know if they've done studies or if universities or other organizations independent of Plax have done studies, because that's the most important thing. And they can tell you, yes, this indeed is effective, or no, it still doesn't do anything. Now, Plax is currently made by Johnson & Johnson. So that is the manufacturer. So Johnson & Johnson, if you're interested, please reach out. Let me know, is Plax clinically effective or not? Because as of right now, the literature that I have seen says no. The other caveat, Plax has had kind of a higher content of sodium. That is, if you read the ingredients, there's a little bit of a higher content of sodium, and that is, it's in there. Now, that, depending on how the formulation is now, because that may have changed since I've been looking at it, I'm still seeing sodium in the ingredients, folks. So depending on the concentration, that may or may not have effects on folks who, for example, have high blood pressure. So anybody like that needs to be very careful or cognizant of what amount of sodium that they're taking in every day, because that does affect the blood pressure. So now with sodium, if it's in the mouth and being swished around for 30 seconds, there can be some absorption into the system through the sublingual tissues, because those are very thin and they tend to absorb things. So sodium is one of them. So that's something to be concerned about or aware of if you have high blood pressure and you're thinking of using Plax, whether or not it is effective. If you like it, what am I going to do? I'm not going to tell you not to go buy it if you like it, but that's up to you. But as long as you know, there could be higher sodium content. And again, I'm saying could because formulations change over the course of time. It was in the past known as something that had a higher sodium content and could potentially be a problem maybe for folks with high blood pressure. So just make yourselves aware, and hopefully the manufacturer, Johnson & Johnson, can reach out and tell me, hey, we've changed it, there's less sodium, it's at a much lower level now, and we've got studies from independent universities, not funded by Johnson & Johnson, that say that Plax is effective. So as of right now, Plax to me is a no-go, but as of right now and pending further review. So for those of you interested, Plax, probably not good, but I'm waiting, and I'd like to see more recent literature, because what I've seen online is kind of a little bit on the dated side. So maybe there's updates, maybe they've made it better, and it would be great to know that. So thanks again for joining me, and hope you're all staying well and healthy.